Okay, so what we have here is a therapy that I use called the K-laser. How I came across this is about 2 summers ago. I was at a picnic and I was playing volleyball, and I went to hit a ball and I hyperextended my elbow. Okay, so I played through the game. Of course, I just had a little bit of soreness. At the end of the game, it was a little bit more sore, and then when I woke up the next morning on Sunday morning, I couldn't move my elbow. I couldn't bend my arm at all. So knowing how long it takes for that to heal, and knowing I had to see a large amount of patients on Monday, I called up a friend who I know recently bought the K-laser, and I went over to his office. He checked it out. He ran the K-laser on me, and about an hour or two later, the pain was almost completely gone. So I was pretty sold on it from there. So I spoke to the rep from the K-laser. He brought it down. He explained exactly how it worked and what it did, and I bought it as a result because it just made perfect sense to me. Now, this is a Class 4 laser, and Class 4 lasers are much different than any other laser. These are very high-tech pieces of equipment. They've been in the U.S. since about 2002, approved by the FDA, and I've had this instrument for about 2 years. And what this actually does is really it speeds up the body's ability to heal itself. In other words, if I get an area that's inflamed, whether it's an elbow, a wrist, a knee, a disc problem, joints in the back, wherever it may be, is that when you get an inflammatory response in there, it's your body's response to try and clean up that area and get rid of the soreness and the inflammation. Now, what this does is really just works with the human body to speed up that process. So it increases the oxygen to the area, it increases the nutrient level to the area, increases the fluid to try and heal a lot faster, and it does it very quickly. And one of the great things about the K-laser is the penetration depth of this. This is much different than if you had muscle stimulation or ultrasound or interferential or any type of therapy. Because this can penetrate so deep into the areas like the spine or in the knee or whatever it may be, that the healing process takes place so much quicker. And I love this, and I have patients who use this with disc problems where it's running into their arm, or they have low backs where it's running down their leg, or they have pain directly in the neck. And it really speeds the care up, and it gets rid of the pain very quickly. So, and it's also, no drugs, so that's what we're into here. During the procedure, you're not going to feel any pain or any discomfort. All you're going to feel is a slight warmth, okay? And it's just from the beam coming out. And that laser, what it does is it's going to use a certain wavelength of light to do something called photobiomodulation. And what that actually means is the wavelength of light is going to stimulate the body to, like I said, to increase blood supply, to increase nutrient supply, increase fluid transfer from the body to get rid of that inflammatory response as quickly as possible. And it can work as little as 4 to 6 treatments on certain things, and sometimes for chronic conditions like chronic low backs or something, it takes a little bit longer, but I'll tell you what, it speeds the pain relief and is a remarkable instrument. And so what the patient will do if they're lying on their stomach and we're doing the lower back, it's just simply, we're gonna run it up and down nice and easy. The only thing they're gonna feel is just the weight of the instrument on them and maybe a little bit of warmth, and that's about it. There are no contraindications. In other words, there are no bad effects from this. Really what I've seen in 2 years is just patients saying, wow, I had a remarkable change with this, and really decreased my pain and very quickly. When will the K-laser be used? Is it something for you, or are we going to use this on every patient? Absolutely not. This is really determined on a case-to-case basis. If you have a chronic condition, sometimes it can take up to 8 to 10 sessions with us. Sometimes it's a lot less, but we're going to use it in conjunction with the chiropractic care and try to decrease the pain. So that's the K-laser, and the K-laser is an excellent therapy, and it's one that works in conjunction with chiropractic.
Laser therapy was born from scientific research over 30 years ago in Europe. Today, the advanced technology of Class 4 deep tissue laser therapy is an effective alternative to surgical procedures, does not require the use of drugs, or have any known side effects. Studies have proven that Class 4 laser therapy achieves faster and more effective results than the treatment from other modalities. Albert Einstein, who brought us the theory of relativity, first proposed a process that makes lasers possible. By the mid-1960s, scientists discovered that lasers could be used to accelerate how fast the body heals after surgery. Since that time, there have been over 2,500 published medical research papers on the subject of laser therapy, accelerated injury healing, and pain relief. The Class 4 laser provides a deeper penetration that allows for faster treatments with a variety of options and a greater number of applications. This translates into positive physiological outcomes that include advanced pain relief, accelerated healing, increased cellular energy levels, improved range of motion and function, reduction of inflammation, and more. During laser therapy, the infrared laser light interacts with tissues at the cellular level. Higher levels of ATP are produced, which then increases metabolic activity within the cell, improves the transport of nutrients across the cell membrane, and initiates the release of nitric oxide. These events lead to a cascade of beneficial effects, increasing cellular function and health. During each painless treatment, laser energy increases circulation, drawing water, oxygen, and nutrients to the damaged area. This creates an optimal healing environment that reduces inflammation, swelling, muscle spasms, stiffness, and pain. As the injured area returns to normal, function is restored and pain is relieved. The wavelength of light transmitted may be scattered by one type of tissue and greatly absorbed by another. Depending on its components, each type of tissue, such as skin, blood vessels, sweat glands, pigment, and hair follicles, has its own absorption characteristics. As the light is absorbed, photon energy is transformed into biochemical energy, increasing cellular activities. The laser's ability to biostimulate tissue growth and repair results in actually healing tissue. The Class 4 therapy laser wavelength is important because the wavelength must be appropriate for proper tissue penetration and proper treatment. The K-laser was the first to employ dual infrared wavelengths simultaneously of 790 nanometers and 970 nanometers. These dual wavelengths are more efficient, healing the tissue while also aiding in pain relief. Combining the K-laser's dual frequencies of continuous wave and modulation provides the clinician with the most advanced laser technology. The power settings of the K-laser allow it to be used to treat a variety of injuries and pain, such as neck, shoulder, back, wrist, knee, foot and ankle, and lower extremities.
With the K-laser, yes, I'm healing fast. I like it. No discomfort, no pain whatsoever. And it does work.
The thing that's so impressive about the K-laser is how quickly it works. I mean, you can be literally walking in the office with the pain, right there at that moment, and you walk out basically pain-free. Clearly, I attributed the laser's ability to speed up the recovery process on that area as instrumental in making it possible for me to go back to work as early as I did.
As a head trainer in the National Football League, we have a number of challenges. We have 85 players during training camp. We have over 65 during the regular season. They all have injuries. We've got limited time to try to treat the athletes to get them back out on the field as quickly as we can. K-laser is effective at reducing muscle spasm, reducing pain, reducing swelling in any number of types of injuries, be it the typical muscle strains as well as sprains of joints. We've had players with stiff and sore necks that after a couple of treatments with the K-laser are markedly improved and are practicing without any restrictions whatsoever. We've had other players that have had chronic soreness in the low back that have found that really the only thing that gave them true relief on a consistent basis was the K-laser.
Laser therapy was born from scientific research over 30 years ago in Europe and perfected by K-Laser USA with the latest technological advancements today.